Nearly three-quarters of fire injuries among people over 65 at a major U.S. burn center involved home oxygen therapy. This isn't a rare accident. It's a hidden crisis in homes across the country. Millions rely on home oxygen for chronic conditions like COPD. It's a lifeline, but it comes with a risk many don't realize. Fires involving home oxygen are exceptionally deadly. 1 in 3 reported cases results in death. The true scale is likely much higher due to underreporting. A Michigan study found deaths could be 20 times higher than official records. This is a silent epidemic, affecting our most vulnerable. Most people don't think of medical oxygen as a fire hazard. After all, oxygen itself doesn't burn, but that's a dangerous misconception. Patients and families often get a quick tutorial and miss the critical fire risk warnings. This isn't a detail to overlook, it's life or death. As our population ages, more people will need home oxygen, and the risk will only grow. Without better awareness and safety protocols, preventable injuries and deaths will rise. We're at a turning point. It's time to bring this issue into the light and take action. The first step is acknowledging the problem. It's real, it's serious, and it's in our homes. We need to rethink fire safety, not just smoke alarms and kitchen fires, but the hidden risks of medical oxygen. The numbers are only projected to grow as our population ages. This is a demographic reality we must face. We have the opportunity to save lives by understanding and addressing this risk. Let's not wait for more tragedies to act. Awareness is the first step. The danger is real and it's closer than we think. Let's face it together. Why are home oxygen fires so catastrophic? It's all about the science. Oxygen doesn't burn, but it makes everything else burn faster and hotter. In a home with oxygen therapy, the air, clothes, and furniture become oxygen-enriched, turning everyday items into fuel. In these conditions, a tiny spark can ignite a violent blaze in seconds. Cigarettes, candles, gas stoves, even a spark from a power tool can trigger disaster. These fires move fast, leaving little time to escape, especially for those with mobility issues. First responders face extreme heat and danger, often arriving too late to save lives. The victims are often older and unable to evacuate quickly. This isn't just theory. Firefighters and burn center staff see the devastation firsthand. In July 2024, a fire in Fall River, Massachusetts, killed 10 people, possibly linked to smoking and home oxygen. These aren't just statistics. They're real people whose lives were cut short by a preventable danger. Understanding how these fires start is the key to stopping them. The rules of fire change in an oxygen-enriched home. Prevention starts with knowledge. Sometimes, change begins at a hospital bedside. 18 years ago, a Michigan burn center nurse treated an older man burned while using home oxygen. He turned off his tank before lighting a cigarette, but lingering oxygen ignited, causing severe burns. After treatment and extensive education, he was sent home. 19 days later, he returned, burned again, after smoking with oxygen. For the nurse, it was a devastating realization. Education alone wasn't enough. Addiction and habit can overpower even the clearest warnings. This experience sparked a new approach, one that went beyond pamphlets and lectures. The problem was bigger than one patient. It was systemic. Preventing these tragedies would require collaboration across healthcare, public safety, and families. That single story became the catalyst for a nationwide movement. It showed that real change needs more than information. It needs teamwork and innovation. The nurse's heartbreak became the spark for a new way of thinking. The Passion Projects initiative was born from this moment. It's about protecting home oxygen users everywhere. One patient's repeated suffering led to a movement. Sometimes the smallest spark can ignite real change. This is how progress begins. And it's how lives are saved. The Passion Projects initiative grew from one nurse's frustration into a powerful coalition. The idea, no single group can solve this problem alone. Burn nurses, doctors, firefighters, home healthcare providers, and families now work together. This collaboration breaks down silos and creates a united front against deadly home oxygen fires. A major focus is improving data. These incidents are underreported and often misclassified. The initiative pushes for better tracking and a dedicated medical code. Accurate data drives prevention and policy change, but it's also about empowering patients and families to be partners in safety. By uniting everyone involved, the initiative builds a safety net that goes beyond blaming victims. It's a shift to shared responsibility and community-wide commitment. One of the most dangerous myths is that turning off the oxygen tank makes it safe to smoke. That's false and often fatal. Oxygen lingers in the air, on clothes, and in hair, creating a personal oxygen-enriched environment. Even after turning off the tank, the risk remains for minutes. Smoking is the leading cause of home oxygen fires. Up to 90% of deaths are linked to it. Over a third of home oxygen users still smoke, driven by addiction and stress. Education alone isn't enough. We need safer environments and real support. E-cigarettes and vape pens are not safe alternatives. They're also ignition sources. Their batteries can even explode in oxygen-rich air. The message is clear. There is no safe way to smoke or vape on home oxygen. Any spark, flame, or heat source can trigger disaster. The risk is constant, even when the tank is off. Safety means zero tolerance for ignition sources. Technology can add a crucial layer of protection. Enter the thermal fuse, or fire break, a small device installed in oxygen tubing. If a fire starts, the fuse melts and instantly stops the oxygen flow, containing the blaze. Thermal fuses have been required in the UK since 2006, saving countless lives. Yet in the US, they're not standard, mainly due to cost and lack of insurance coverage. Home healthcare companies hesitate to provide them without reimbursement. Some fire departments distribute them, but that's not enough. Advocates are pushing for policy change to make thermal fuses mandatory and covered by insurance. The cost is tiny compared to treating burn injuries or losing a life. This simple device should be as standard as a seatbelt or smoke alarm. It's a common-sense solution waiting for widespread adoption. Let's make it happen. While we push for systemic change, there are steps every home oxygen user can take now. No smoking, vaping, or open flames, ever. Post no smoking signs and keep all ignition sources far from oxygen equipment. Stay at least 5 to 10 feet from stoves, heaters, and grills. Use a microwave instead of a gas stove when possible. Watch out for sparks from razors, hair dryers, or power tools. Avoid flammable lotions or products while using oxygen. Store oxygen cylinders upright, never in closets, and keep equipment clean. Test smoke alarms monthly and consider home fire sprinklers. Have a realistic fire escape plan, especially for those with limited mobility. Keep exits clear and a phone nearby. These steps empower patients and families to take control. Sharing this knowledge can save lives. Home oxygen safety protects more than just the patient. A fire in one home can threaten families, neighbors, and first responders. Firefighters face extreme danger and trauma in these incidents. Preventing fires protects their health and well-being too. The economic impact is huge. Treating severe burns costs hundreds of thousands, even millions. Prevention saves money, resources, and lives. The Passion Projects. Initiative's collaborative approach is vital. This isn't just a patient problem, it's a community problem. When everyone works together, the safety net is stronger. Protecting one person ripples out to protect the whole community. Prevention benefits us all. Preventing home oxygen fires takes awareness, education, technology, and advocacy. It's not just a medical issue, it's a community responsibility. The stories of those lost remind us. These tragedies are preventable. Healthcare providers, home care companies, lawmakers, and firefighters all play a role. But the power to make a difference lies with you too. Share this knowledge. Talk to friends, family, and neighbors who use home oxygen. Help them check smoke alarms and ask about thermal fuses. Your voice matters. This is about empowerment, not fear. The movement that began with one nurse's heartbreak is now a national effort. Every person who joins adds another layer of protection. Visit nfpa.org for more resources. Spread the word. You might just save a life.